Good morning. I don't understand why a lot of my acquaintances, Westerners here in Thailand, use the private healthcare system. RAMS, Bangkok Hospital, there's quite a few of them. I've been using the public hospital system for the 13 years I've been here. I've been to a couple of the private hospital systems, and I'm going to post a video tomorrow about Bangkok Hospital and how they actually locked us into a floor electronically. The fire escape doors wouldn't open, and they held us in there until we paid them nearly 20,000 baht. I should have called the police for kidnapping because we hadn't received any service at all. We were just making inquiries, waiting for a doctor. Anyway, that's another story. The private system in Thailand beats any Western system I've ever seen. If you go as an emergency, as I have done, I collapsed, I had a stroke in 2022, Christmas Day, 8 a.m. in the morning. The ambulance arrived probably 10, 12 minutes. They took me into Mayon Hospital. Mayon Hospital didn't have the equipment to monitor me suitably, so they put me back in the ambulance and sent me to the primary care provider in the city, and that's another public hospital. So they put me through a myriad of tests in there. The ride was probably 20, 25 minutes. The testing was probably an hour and a quarter, and they did CT scans, they did heart monitoring, and they said, it looks like he's stabilised, there's not much we can do here, so it would be best that he went back to Mayon. They put me back in the ambulance, took me back to Mayon. The ambulance both ways cost $25. That includes the nurse on board, who is now a personal friend. At Christmas time, around the 25th, we always go to Mayon Hospital with the back seat of the car loaded down with tins of butternut cookies, and we hand them out to every department in the hospital. And it's a fun occasion, and we enjoy it. We know most of the staff by name in there, and everyone that walks into that hospital is treated like a VIP. Not just because we're wealthy in comparison to Thais. When an old Thai walks in with his clothes hanging off him, he's treated the same way as I am. It's quick, it's fast, it's expedient, and it's as cheap as chips. I mean, for me to go into the hospital to have a tooth extraction was $10, and the dental surgery looked like it was built for a spacecraft. It was amazing. And the most I ever pay for physical services, seeing a doctor, an inspection or whatever, and getting stitches maybe, it's $10. Susie's not charged anything. She's a Thai national, and she's over 60, so she pays nothing. Under 60, they pay about $1.10. Doesn't matter what happens. You could get a heart transplant for $1.10 if you're a Thai native. A heart transplant for me here would be probably less than $10. It's also indicative of how well the healthcare system works at the private level, that specialists in private hospitals donate 1 day a week in the public system. So the doctor that operates on you might well be a Western doctor anyway. It's just an amazing service. And to all those folks that I know that are still using the private system, I mean, obviously you don't care about money. But if you think you're getting better service, you're not. The public service outweighs the private service by 1,000,000%. If that's not good enough for you, keep wasting your money. I'm gone.